Everyone here, the patient, and we are also almost everybody fought on this tsunami. This diagnosis is a source of many feelings and emotions of sadness.
Riu turenda kuhe aria matumite muthenya ukorwe wa kwagirira ngerenwa na nigetha Ngai amarathime.
Wa hiyo board ambayo inahusisha wazazi ambao ni wenye shule. Sisi walimu kazi yetu ni kusimamia administrative issues, lakini shule yenyewe kuwa ni ya wazazi na wale ambao wanasaidia.
So all our patients that are coming in, they are going to be taken their height and weights and also the blood pressure. This is where we capture maybe even some of the new cases. Someone may have just been coming for a very small case, and then you find that they also have the blood pressure. So in case we get such a case, we have a nurse who will immediately refer that person to the consultation rooms. You can come in and see the machines. We have our machines that are already connected, and we are doing the height and weight. We're also doing what we call the BMI. Another stage for all the men, we will be doing also the PSA, that is a checking for the prostate cancer. And then now from this card, the small treatment card, the patient attended nayo kwa kila stage that they are going to be attended to. So ma'am, hii karatasi utaenda nayo kwa station zote mpaka sasa tutamalizana na wewe mpaka hii karatasi kadogo kanamba.
Usiongee, kamera inaweza kupotoa.
Gerald Matunda, working for the Monte Kenya Limited as a head of human resources. Today we have a camp here, a medical camp where we hope to reach up to 1,000. That was our aim, and we are looking from the way the turnout is. It is overwhelming. It's very, very overwhelming, because we hope by the end of the day we could be heading towards 2,000. So we plan for 1,000. We are hoping to get, the way the turnout is, we are looking at 2,000. So far we have done 957, and this is 12 o'clock. So you can imagine when people have finished their works, they are coming here, and we are ready for them. We prepared well. So our aim is to make an impact, to give back to this community. We work closely with them, and we've been working as a company. One of the pillars within our operation is medical, and medical services is very vital in the community, in the country. And as you know very well, this is October, the breast cancer month, where we hope we are going to screen and give back to the community in terms of the WHO requirements, and we hope to make a difference here. So by and large, we are looking at impacting from children. We are counseling children. We are giving ENT services. We are giving HIV services, breast cancer screening, prostate cancer, physiotherapy. All these services are available today, and we hope at the end of the day everybody will be impacted and will live here with a happy, leaving behind a happy soul within this community. Medical is very critical to our operation. This is a pillar, but we emphasize so much. It's the core of our business. So we've been doing this. It's not the first time. We'll be continuing to do this, and we'll do this so frequent, because we know our community where we do business matters, and we have to work jointly to give back to the community and make an impact, so that they feel we are together, we can grow together, and work for the country. One thing I've learned today, there is a medical dispensary around where people get services. Maybe what we can consider is to come here very frequently to give these services, because I believe when we hype it up, we talk to the community, everybody comes. Unlike when you visit a dispensary where you choose to go, you only go when you are sick. But when we do it as an event, with coupled with proper screening, I believe we can get more people participating, and we hope to become here more frequently. We know cancer is really a disaster in our society. It is very costly. Once it is gone, you cannot turn back. So we hope to get quite a number of the participants here to go through that screening. Unlike if they were to go through a normal setup, very few will go. That's why we chose for this month to come back here, to come in this community, so that we get the old, the young coming for this screening. So it is quite important to be screened early, and we believe from what we are doing today, our theme being that we are really focused on that, because we know the month we are in, that's October, and we know the guidelines, medical guidelines, that it is very important to do it this month. So we believe screening is an answer to cancer, and early detection is the remedy. So we hope today, as we do it, we'll do it to everybody who is here, who is willing, and then we'll be able to make or recommend some of the patients who may find here for further management. We have a plan as a company. We constantly work with the community in terms of CSR, and the CSR is not only medical. It revolves around the environment. We have contributed in planting trees around the communities. Latest was in Gatanga Sub-County community, where we planted up to, I think, 7,000 trees. We give water. We supply water to the community around us. That's one of the key things. Again, we advise the community on how to harvest such kind of things. So another one is we do infrastructural support. That is making roads. You can believe it. One thing I know is we do a lot in terms of infrastructural assistance, in terms of maraming roads in schools. The latest we done even last 2 weeks in a school. So we do a lot of CSR activities. It's not only medical. We really work with this community or communities around us to ensure that we do together, we grow together.
Dr. Florence Kagwaini. I'm the medical officer of health, Gatanga Sub-County. This is Breast Cancer Awareness Month, the month of October. But we're also screening for cervical cancer in women of reproductive age, and we're also screening for prostate cancer in men who are aged 40 years and above. Currently we don't have cancer register in our county, leave alone in this locality. But going by what is nationally known, breast cancer leads in the cancer statistics, followed by cervical, prostate, then esophageal cancers and colorectal cancers. Approximately we lose 3,000 women per day to breast cancer. So it's a worrying situation, and resources and every effort need to be focused to screen early. We say screen early, diagnose early, treat early, and the outcome will be better. And unfortunately, a lot of people think it is the women who should go for screening, but we are here to encourage our men to go also for breast cancer screening, because it is also affecting our men. And unfortunately, because the breast in men do not have a lot of tissue, it tends to be very aggressive, spread very fast. So we also encouraging them to go early for screening. We say early screening equals early diagnosis, equals early treatment and better outcomes. So we encourage our men to go to the hospital. Do not wait for the signs and symptoms. Just go and say you have come for a checkup, and take advantage of this month. I'm sure there will be very many offers, even in other private facilities, just saying, come, we screen you for breast cancer. So kindly our men take advantage and just walk in and say you have come for screening for breast cancer. I'm actually impressed because most people don't go for screening, because screening means you have not waited for any signs or symptoms to come up. You have actually just gone to be checked if you have a problem. So when I see a queue outside the screening areas, it is very impressive. And this should be highly commended to all of us, that we don't need to wait to be sick to go to hospital. We need to go early so that whatever may be ailing us is caught early. They are also checking for non-communicable diseases or conditions, hypertension, diabetes. They are treating people with arthritis, people with eye problems, people with mental issues. We need to say that COVID has brought in a lot of mental issues and a lot of gender-based violence, and we can see even what is being reported every day, that this other person has killed their neighbor, their family. So we have mental issues that have not been addressed for a very long time. And in health, we say there is no health without mental health. So I think we also need to refocus our efforts and resources to well-being of our people mentally. So they are doing a lot of counseling. There is a corner that is dedicated for counseling people with mental health issues, gender-based violence. We are also testing for HIV. I've seen a corner very impressive that is a teens corner addressing teenage pregnancies and sexual and reproductive health of our teenagers. So this is very, very impressive. This area, we have a lot of water-washed illnesses, diseases that come because there is scarcity of water, and the water that is available is probably not clean. So we also have a lot of eye infections, skin conditions. Okay, we have diarrheal diseases. Schistosomiasis is one of the diseases that comes when the rains come and the people are going to the shallow waters to fetch water. So those are some of the conditions we are dealing with, and they are very prevalent in this area. As I said earlier, we would recommend Del Monte rethinks of how to assist the community here by helping them access clean, safe water for drinking and home use.
Jina yangu naitwa Karen Wanja wa Lwege. Nashukuru kwa hii siku ya leo kwa hii kambi ambayo imeundwa na Monte Kenya Limited, kwa watu wote wakuje wajitokeze kwa hii ugonjwa especially ya kansa. Watu wengi wamekaa kwa manyumba bila kujua ni wagonjwa. Ningehimiza ya kwamba watu wajitokeze ili waweze kujua their status, na mimi kama survivor nilijulikana niko na hii ugonjwa mwaka wa 2017, it was on February, na kwa hiyo jana ya hii ugonjwa it has a lot of challenges. Juu ndio unaona hata marafiki wanakutenga, wengine hata waukaribii usiwashikisha ugonjwa, na hata kwa hiyo safari unaona hata mwili yako inakuwa haina nguvu, huwezi fanya kazi mzito, unapoteza kitu kama hata afya ya mwili na unapoteza nywele yote. Ni vitu nyingi ambayo unapoteza kwa hiyo ugonjwa, lakini mimi ningeumiza watu ya kwamba ni mzuri wajitokeze wapimwe ili waweze kupata matibabu. Nashukuru hata Del Monte Company sana kwa venye wametusikilia, hata kama uko mgonjwa. Kama mimi nilikuwa nafikiria nikigojeka hata nitapoteza kazi, lakini mimi wameniliteni kwa kazi na wamekuwa wananisapoti sana. Hata wakati nataka kufanywa lab test na siko kazini nafanywa, na zile dawa zingine sinakuwa kazini wananisaidia nazo. Na hata kama ni wakubwa wetu kutoka kwa HR, unaenda unajiongea na wanakusaidia kwa njia ya kupea kama ni right duty, wengi hivi na favorable safety ya kufanya kazi. Na hata kwa ile njia yote wamekuwa very supportive pamoja na wafanyikazi wote. Let me say the Del Monte fraternity all wamekuwa very supportive kwangu, na si kwangu peke yangu, ni watu wengi sana wako kwa kampuni wakiwa na challenges za mwili na wanasaidika na wanaangaliwa vizuri na hawatengwi kama wafanyikazi wale wengine. Kwa hivyo mimi nawashukuru na naendelea kuhimisha watu ya kwamba wajitokeze, wasijifiche, wasiogope. Kansa si ya kuua, kansa si lazima ukufe. Watu kufa na mambo mengine yote, hata unatoka kwa nyumba asubuhi na unakufa bila kugonjeka. Ningehimisha watu wajitokeze tu, sawa mama, wajitokeze bila uoga, waweze kupimwa na waweze kujulikana shida zile wanaweza kuwa nazo mapema.
Nafurahia sana watu hapa Matunda kwa hii kampu yenye tumeletewa, na tungesema iendelee na kukuja juu mambo na hospitali hapa imekuwa changamoto. Hospitali kubwa tunaenda Murang'a, ukienda yenye iko hapa area hii hakuna dawa. Sasa tunaomba county government bwana Kang'ata endelee na kuletea matibabu hapa kufadi hawa watu, ndiye hospitali hapa Matunda ikuwe na dawa na tuwe tunatibiwa. Nimesema ni asante, matibabu yameendelea vizuri. Kuna mama wazee hawezi kufika mahali pale Murang'a na wameweza kufika hapa Matunda. Kwa hivyo hiyo mambo imekuwa mzuri. Nimesema asante, madaktari wanaendelea vizuri, wanatibu watu kwa haraka, hata kama laini ni kubwa wanaendelea, wanajaribu, wanang'ang'ana. Nimesema ni asante kwa watu wamefadi, na hiyo kitu iendelee, iwe nakuja hapa juu imesaidia watu wengi. Mama wengine ukiangalia huku unaona ni wazee wana miguu, wanashindwa na kutembea, na wameletewa matibabu hapa karibu kwa Matunda. Hiyo ugonjwa wa kansa imeleta mashida sana hapa, watu wana pesa ya kwenda kupimwa nje za nje. Tungeomba county government itujengee hospitali Murang'a tuweze kupigana na hiyo ugonjwa wa kansa, na watu wajitokeze, wanaume wa mama wote ndio waweze kupimwa na wajue hali yao.